Does adapting any physical activity help in managing the type 2 diabetes? Let us find out. Diabetes as a chronic condition has been on the rise in the recent past. And also there has been a rise of other non-communicable conditions like hypertension, cancer, and all that. So one thing that can be attributed to the rising of this diabetes, because actually it's reaching the epidemic levels, is our lifestyle. We are leading, most of us are leading an inactive lifestyle. We are eating a lot of meals and you're not expending it anywhere. So before I explain why you should adapt a physical activity in your daily life in order to manage your blood glucose levels, and for those who have diabetes, for them to manage blood glucose levels and increase their insulin sensitivity, maybe I should explain to you how diabetes body requires energy as the main source of energy as its way of working and performing several functions, like for example walking, thinking, or even eating and sleeping. So you find that when we eat our food, let me give an example. You've eaten your food that is containing your carbohydrates, your proteins, and your fats. It undergoes the digestion process where it's broken down to simple molecules. Let me just use molecules. Like now it's broken to glucose, and the proteins will be broken down to amino acids, and the fats will be broken down to the fatty acids. So these molecules have to be taken up by the body cells or the tissues for them to function well. So there's a vital organ in your body called the pancreas that will have to release a hormone that we call insulin. So it is this insulin that is involved in helping your body take up the glucose from the bloodstream to be used in the tissues. This glucose is usually stored in three main areas. One is the liver, another one is the muscle, and the other one is the adipose tissue, the fat tissue around your abdomen. So it takes this one glucose to be stored for further use. And some can be used by other tissues, but the excess of it now can be stored so that when there is a crisis, they are released to be used. So for a diabetic patient, you find that either they can have insulin, but the cells are not sensitive enough to be using this insulin. So you find the pancreas, what does it do? It produces more and more insulin to compensate for that, for more insulin to be produced so that excess glucose that are in the bloodstream are being taken by the tissues. So sometimes the pancreas becomes overworked. It has produced more and more insulin, and yet the glucose, it is not effective enough to counteract the effect of high blood sugar levels. So this one results in more glucose levels hanging around the bloodstream, and that's how diabetes comes about. So diabetes is just a condition where there is increased levels of blood sugar levels beyond the normal level. So the muscle will take up 70 to 80% of the glucose that was produced. So during exercises, when you're exercising, this glucose that was stored in the muscle is now being used up to the extent. So the longer you exercise, it depends with the intensity of your exercise, whether you're adapting aerobic exercises like walking, jogging, swimming, and all that, or highly resistant exercises. So it will also depend with the durations. So after exercising for long, these stores become depleted. The glucose becomes now used up. So the body will either turn up to now using the glucose levels from your liver or from the adipose tissue. So for a diabetic patient, the excess glucose that was hanging around your bloodstream, as I said, or the excess of it in the bloodstream, now the muscles will start taking up this exercising, and in that way you're lowering down your blood sugar levels. So that's one of the way exercise will help in managing your blood sugar levels. One is taking up the excess blood glucose levels in your bloodstream by the muscles. And then two, The more you exercise, the more you're expanding your muscle mass. Your mass, or the muscles become bigger and bigger. The capacity increases for it now to take up more glucose. And in that way, you're lowering down your sugar levels. Through exercise, you can you can manage your weight well. Exercise helps you in reducing your weight for those who diabetic patients that are overweight or obese. And any loss of weight, like example 10%, will help in improving your insulin. The cells will respond well to the insulin, either when you're taking your oral drugs or you're injecting yourself. The insulin hormone in it will be taken up well by the body cells. And then another way of you're going to lose your weight well is you're burning calories. The excess of it that was stored, the glucose and all that, the fat, the amino acids, you're burning these calories and therefore reducing your weight or maintaining your weight well. Then another way your exercise will help you in burning the visceral fat, the abdominal fat, the fat tissue around your abdomen. One way, when excess glucose is stored in the fat, you start adding weight. That's one way. You start adding weight around here, and that one increases your risk of acquiring cardiovascular diseases like hypertension and stroke. So another way is that when you're adding more fat around your abdomen, the fat cells will produce hormones or chemicals that will counteract the effect of insulin in such a way that it will make insulin more harder to work. Hit the gym or just adopt a simple workout there at home, either when it involves stretching, doing the house chores, cleaning your garden and all that. That's also a form of exercise. Keep yourself busy so that you help your cells to be more sensitive to insulin. You help in managing your weight, also improving your cardiovascular well-being. You're strengthening your cardiovascular system, the nerves, because most of the time the complications that diabetic patients suffer from are complaining of nerve pain, the neuropathy and all that. So you're improving the flow of oxygen, the nutrients and the blood throughout your body, therefore also improving your moods and also managing complications such as depression. It is true that if you adapt a physical activity depending on your general body condition, you can manage and cure diabetes, any type of diabetes, whether it's type 1 or type 2. You can manage your blood glucose well because exercise will help you build more muscle, strengthen your muscle mass, increase your muscle capacity, increase uptake of excess glucose levels in your bloodstream. It can also help you manage your weight well or lose your weight in case you're overweight or obese. And then also burning your calories, burning your visceral fat, and therefore at the end of the day, improving your insulin resistance. So, find out from the next episode on what we recommend for a diabetic patient before you start exercising and what are the risks involved when you are exercising. So thank you so much for joining me until the end of this episode, and kama kawa, mimi ni daktari wako wa lishe bora Jemimah Egesa. Until another episode at such a time, bye.